Okay, so welcome to the Asia Democracy Research Network online seminar entitled Reassessing 2020, How Asia Coped with the COVID-19 Pandemic here. This is very, very timely the subject as well as the very policy relevant the issues here. So today, originally we have the four great representatives of the research institute around the Asia country here, but unfortunately one of the presenter here, the Professor Maiko Ichihara, is unable to join us due to some health issue here, so that we're going to have the three the very wonderful speakers here. So let me introduce each of them in a brief way here. So our first presenter will be Dr. Thawilwadee Bureekul. She is the director of the research and the research and development office at the King's Prajadhipok Institute in Thailand here. And second presenters, the Dr. Francisco Magno. He is a research fellow at the Jesse M. Robredo Institute of Governance in Philippines. And our third presenter will be the Dr. Pradip Priya. He is the executive chairperson at the Samartha Foundation in Nepal. So we are going to have the three presentation, as I said. So first presenter will be the Dr. Bureekul from Thailand. So you can start your presentation right now, and you have 10 minutes. But if you want, just 10 to 15 minutes is assigned to your presentation. Okay, so please have the Dr. Bureekul for the presentation about the situation of Thailand here.
Okay, good morning. Is it okay? You can hear me, right? Okay. Firstly, I would like to thank the EAI and ADRN for inviting the Thai team to prepare this paper, because it's very interesting when we do this paper. Firstly, I would like to tell something about the emergence of the COVID in Thailand, because Thailand was the first country to record COVID-19 infection outside China after the outbreak in Wuhan, China. On January 13, 2020, or last year, the Thai Health Ministry confirmed the first COVID-19 infection cases in Thailand. Two Chinese tourists from Wuhan was here and was recorded to get infection with COVID. And then Thailand became the hub of the pandemic, prompting various countries all over the world to warn their citizens against traveling to Thailand. And in response to this, the government launched many measures to control the rapid increase the new cases. And the first measure was the lockdown in Bangkok. And then many measures came out. And in March 2020, the COVID-19 situation became more serious. So the government established the management center, COVID-19 Situation Management Center, in order to cooperate with various organizations and provide information of emergency and information about the situation to the people of Thailand in order to avoid the misinformation. So that's the first start. And then many severe situation occur after the boxing stadium situation. Some group of people visited the boxing stadium, and then the COVID infections was detected. So we would like to explore what kind of challenges that the Thailand face and how the government of Thailand manage the situation. So this is the way we conduct the paper, and you see a lot of policy came out, and the policy that related to the people, the business sector, and the tourist business on especially all these groups were affected by the COVID-19 first, like the small and medium-sized business, they got impact from the COVID-19. For example, the massage parlor and also the beauty salon were closed down first, and then another business, small business. So that's what we have learned so far, that okay, the situation was very bad, and then the tourist situation got affected. So the objective of this study is to study the situation of COVID in Thailand, how the government cope with that, and the lesson learned that from this, and also the policy recommendations for this. And the research methodology that we use, we do a lot of literature survey on democratic governance and the situation of COVID, and how the various organizations cope with the COVID-19, and also the interviews with many key informants, and also observation for the situation in Thailand, because we are affected by that also. And then we do a content analysis by using the framework that we construct, and the research question based on the challenges and also the responses of the government and various sector, and how the COVID-19 changed the behavior of the people of Thailand, and also affect the policy, various policy in Thailand also. Since the definition of democratic governance that we found from the UNDP, that is the concept of implementation and goal of good effective governance, and it's the combination of characteristics of political system in which the citizen can have rights to govern themselves, and mechanism that can be used as a tool to manage the public affairs, for example. So we use this concept to analyze the situation of COVID-19 in Thailand. And then we construct the conceptual framework in order that we can analyze the data effectively. So we're starting with the system analysis model, starting from input that we got from the many factors that become the input into the process of COVID-19 management. And then on the process of COVID management, there must be a lot of networking, and many organizations working together by using democratic governance. And then we see the output that come out, and then outcome and impact. So all these variables we study, and then we gather a lot of data in order to explain the conceptual framework. So next. So we would like to explain about the situation of COVID-19 in Thailand. It's very interesting that the COVID-19 was confirmed in Thailand on January 13 last year. And at the first stage, the number of cases was very low. And then approximately only 40 cases reported by the end of February. You can see from this graph, and then, but on the March 6th last year, confirmed cases rose to over 100. That's because of the Thai boxing stadium. So it's the area, the people, some people came back from Italy and got coronavirus with them, and then spread on over in the boxing stadium. So then we found a lot of cases occur. And then the government formulate a lot of policy in order to cope with that. And after that, we can control the situation. we can control the situation. So the number of cases is quite stable until recently. That means the end of last year, we were shocked by the new cases that we found from Samut Sakhon, which is the center of Thailand fishing industry. So we got the number of COVID-19 infection. They are mostly the illegal labor that came from Myanmar. Migrant workers from Myanmar were suspect as a major source of the second outbreak of the COVID-19 in Thailand, and over 1,900 cases in 27 provinces were reported. And then according to the fish market, and then few days later, it spread all over Thailand, and more than 50 provinces got a record about this, and then come out with another situation from the east of Thailand, because the case that came out from the bad situation, because in the camping area, the people who went to the camping then were report to get COVID-19, and then it spread all over. And then the police found a lot of camping area in many places of Thailand, and became the significant area that spread virus corona. That's very bad. So make the Thai people very angry, because actually we are going to operate the tourist industry and welcome tourists to come to Thailand again, and then all tourist industry closed down again. Okay, then next, we would like to see how the Thai situation. Okay, we would like to tell about the challenges that Thailand got from this case. Looking from the administrative leadership, is very challenging. If the leader do not have enough knowledge about the COVID-19, they cannot cope with the situation, because it's very new to Thailand, and we didn't know about that. For the first time that COVID was record, and Thai government were very confused about this. But after a certain period of time, then the leader, especially the prime minister, he got the decision to allow the health professional to become his advisor and take care of this case, and control the communication of the case. So according to the institute that established, so the new team came out in order to give information, especially the change of the speaker about this, because at that time the speaker of the prime minister office became the person who gave us the information, but afterward it became the medical doctor who got a degree in psychology report this, and then make us understand more about the case. So, and then the system, the challenge, another challenge is the healthcare system, because how can we cope with that without the good healthcare system, and with the decentralization healthcare budget that can allocate to the local government, how can we cope with that? And also the knowledge about the COVID-19, and also the crisis management. That is the challenges, and also the law and regulation, because the government also announced the emergency decree afterward. So then the measures that the government used since last year, there are a lot of interesting measures. So I would like to group them according to the specific item. Firstly is about the political measure. Political measure that the government uses is about decentralization. Luckily that we have local government, and also we have the governor in various parts of Thailand. So the government allocate the power to local government and to the governor of each province in order to control the crisis in the government. So the governor can work in collaboration with the central government to cope with the situation of COVID in the area. And the governor in each province can order the lockdown in his province if he found the case became severe, and the lockdown in order that the people cannot cannot be able to come in or move out, for example. So in many areas were locked down accordingly. This is the case, the political measure, and also the management center. This is very important because COVID-19 situation management center is the central bureau that disseminate information and report the information every day. During the noon time, the people can turn on television or digital television, and also looking at the website to listen to Dr. Thawilwadee, the guy in this PowerPoint, to talk about the situation day by day, and also they can follow up who got affected and what about the timeline of each people, so that the people can become aware and do not enter the area that infect case located. So another one is about economic measures. Economic measures is very interesting because the government formulate a lot of policy in order that the vulnerable group can be redressed from the situation. For example, for the small and medium-sized industry employee, they were given 500 baht allowance for 3 months, and also the half co-payment. This is the new campaign and become attractive to the people because the SME can participate to register, and then the people who register for this program can pay only half price of the product, and another half will be paid by the government, for example. So this is very interesting, and many people are happy with this. This is some example of economic measure, and also electricity and water price reduction in order to support the industry and also the household, because the people have to stay at home and they use a lot of electricity. So maybe they have to pay more money for the bill. So the government decide to reduce 3% for this and free internet for the people, especially for the student, the children who have to work to study at home, for example. So then it's about another economic measure. This is very important, and this is the way that how the people and civil society respond to the case, because like the fishermen, the fisher folk in the rural area, especially the ethnic group, they earn their living by fishing, but they could not sell their fish to the restaurant because then there were no tourists. So how can we help them? And they didn't have rice to eat. So it's the part of the project. The civil society participate by exchange the fish with rice from the northeast and from the north. So this is very interesting. So the dry fish from the south can, transport to the north and the northeast in exchange with the rice from those areas, from the rice farmer. So this is the part of the program that the civil society initiates. So next one.
Okay, so Dr. Park, yeah, so you have just 1 minute to wrap up because you have already consumed the 50 minutes here. So
okay. So this is another one is about the pantry for sharing. This is part of people participation in order to support the poor, and also technology measure. And another one is about the technology that the China and also the academic sector participate in order to cope with that. This is the application that the people register in order to monitor whether they are leaks or not. And then there are a lot of law and regulation measure that like state emergency decree and communication measure that came out. And the most important factor is the 1 million village health volunteers that make Thailand become effective in taking care of the community, because the frontline people disseminate the information and monitor the situation in the village. This is the very important. And then the healthcare measure is very important, and the academic sector also participate in working with the robot transportation of the food to the quarantine to the COVID infection people. And so, and also the participation of the private sector and the royal family also donate the mobile inspection unit, for example, and also the religion responses. So they change the way the people pay respect to the, for the people who go to the mosque or to the temple, they change the style of behavior that they do the religion activities, for example, and also foreign policy. This is very important because we have collaboration with the ASEAN member country about this case, and also working in collaboration with China about the vaccine cooperation, and also the US, for example, support from the US, and also the we prepare a lot of communication for the foreign worker, like the Myanmar, the language Myanmar, and also the Chinese, for example. This is the way that we do. And we have a policy recommendation for this paper about the democratic governance practice, and also economic measure, and also social policy prevention. Most important thing is that we prepare the policy recommendation for the future prevention of COVID-19 and also the crisis in Thailand also. Okay, I would like to end my presentation now. Thank you very much.
Okay, thank you very much for the comprehensive presentation about the situation for our year of COVID-19 response of Thailand here. So I am very interested in your system analysis from the input to output and outcome here, and the emergency measures are also very informative about how the impact of the emergency measures can contain the COVID-19 spread of the country here. And especially the COVID-19 Situation Management Center has successfully coordinated all the policies and the popular compliance here. That's very informative. Okay, so let's move to our second presentation here. Dr. Magno, you can present the situation of Philippines. Okay, thank you for 10 minutes.
Thank you, Professor Kim. My topic this morning is pandemic governance in the Philippines, democratic recession and corruption risks. Previous studies indicate that established democracies show lower levels of corruption than authoritarian regimes or young democracies. In this regard, it is interesting to consider how authoritarian tendencies have diminished the role of democratic institutions and systems. So this study probes into whether the COVID-19 pandemic further promoted democratic recession and corruption risk in the Philippines. It examines the patterns of irregularities emerging from the implementation of public programs aimed at responding to the crisis. Poorly designed institutional arrangements and weak democratic controls foster opportunities for the commission of illicit transactions in the delivery of public goods and services. Finally, it considers the importance of reviving democratic institutions as a key effort in fighting corruption on a long-term basis. The eruption of the COVID-19 pandemic brought to the fore the severe corruption vulnerabilities in many countries. However, even before the pandemic, it is estimated that an average of 10 to 25% of a public contract's value may be lost to corruption. This is data from the United Nations Office of Drugs and Crimes. Globally, over 7.8 trillion US dollars are allocated annually for public health. With more public funds being made available to fight the pandemic, better safeguards are needed to prevent corruption. The COVID-19 crisis hastened corruption. The potential for corruption in pandemic times are greater, especially when pressures for swift government action may lead to shortcuts that damage the integrity of institutional processes. The main risk areas include the withholding of accurate health data, irregularities in public procurement, purchase of substandard equipment, and misappropriation of health budgets. The Philippine economy suffered heavily with the onslaught of the COVID-19 virus. The Philippine Statistics Authority reported that the gross domestic product dropped by 16.5% during the second quarter of 2020. This came on the heels of a 0.7% gross domestic product decline during the first quarter of the year. The announcement confirmed that the country descended into economic recession given the 2 consecutive quarters of negative GDP growth in 2020. The last time the GDP sank dramatically was during the dying years of the Marcos regime, when the GDP dived by 10.5% during the first quarter of 1985. The economic crisis under authoritarianism was fomented by the unchecked exercise of executive discretion, widespread crony capitalism, and the absence of strong democratic institutions for rules-based governance. These conditions drove investors away. A key role for democratic institutions is to level the playing field in both political and economic competition. These institutions enable the effective application of rules and incentives that govern the behavior of actors in a system. It has taken more than 2 decades to establish credible institutional mechanisms to regain investor confidence in the Philippine economy. This required slow, painstaking moves for reforms that were pushed and carried across the single-term presidential administrations. Among the crucial reforms are the creation of an independent central bank, installation of a competition commission, setting up of an effective fiscal and treasury system, building strong checks and balances, and integrating oversight provisions in public procurement, public-private partnership tenders, and government-owned and controlled corporation activities. The results from these reform efforts are certainly worth the wait. The legacy of the authoritarian years that saw a decrease in GDP per capita after 1982 lingered for 2 decades, until 2003, when the same GDP per capita level was reached in 2003 and higher levels registered in the succeeding years. The GDP growth rates average at more than 6% for the past 5 years. The pursuit of a judicious borrowing and disciplined repayment program over the years earned the country a good sovereign credit rating. The steady growth rate of the economy grounded to a halt with the vicious arrival of the COVID-19 pandemic in 2020. In many places in the world, including the Philippines, calls for the transfer of emergency authority and funds to the executive are sounded to respond to the health crisis in a swift and efficient manner. As huge amounts of public funds are allocated and used to address the health and economic crisis, it is important that the institutional safeguards for transparent and accountable governance, checks and balances, and strong audit and legislative oversight are in place. The corruption risks in the health sector surfaced in a big way with the eruption of allegations regarding the misuse of funds by the Philippine Health Insurance Corporation. This is the national health insurance system of the country at the height of the COVID-19 crisis in 2020. The Philippine Health Insurance Corporation case brought to the fore the weak exercise of institutional control mechanisms in the state-run agency. The resigned anti-fraud officer and head executive assistant of PhilHealth became whistleblowers in revealing information that led to investigations by the Senate, House of Representatives, and Presidential Anti-Graft Commission on the malpractices in the government corporation. Previous to that, rampant financial violations were observed in reports rendered by the Commission on Audit. This indicates the importance of legislative and audit oversight agencies as accountability institutions within a system of checks and balances. In the case of PhilHealth, it has been reported that COA, or the Commission on Audit, had a hard time in auditing the agency due to the difficulty of obtaining documents from its central office. Corruption is perpetrated when there is a deviation from legal and institutional norms. The system of checks and balances to combat corruption can be improved through the adoption of an integrated approach. This requires promoting a comprehensive strategy that includes the facilitation of basic democratic standards, participation of a strong civil society engaged in transparency and accountability work, and the consistent application of the rule of law. Minimizing information asymmetry can reduce corruption vulnerability. The poor information technology system of PhilHealth paved the way for the processing of fraudulent claims in the agency. It is also said that key officials in the agency have strong political backers. There are also regional officials in the agency that have managed to avoid being assigned to other jurisdictions. Public personnel corruption is encouraged by a political culture driven by patronage. Likewise, the regular rotation of key officers and staff will lessen the risk of unhealthy relationships and corruption risks. Corruption should not be simplified as mere irregularities or the act of individuals who went astray. The focus should be on corrupt systems. Corruption prevention strategies should look for ways to reduce monopoly power, limit and clarify discretion, and promote transparency and accountability in governance. As a crime of calculation, corruption could be countered by converting it into a high-risk activity through the judicious application of institutional controls, checks and balances, social accountability, and the rule of law. It is disconcerting that a spate of allegations had been raised on the misuse of public funds amid the uphill battle of the Philippines to control the COVID-19 crisis. The Senate investigated the questionable disbursement of funds by the Philippine Health Insurance Corporation drawn from the 30 billion pesos interim reimbursement mechanism. The interim reimbursement mechanism is an emergency support program for hospitals taking care of COVID-19 patients. During the Senate hearings, Senator Panfilo Lacson wondered why 231 million pesos from the mechanism were released to 48 dialysis centers and 4 maternity clinics with no COVID-19 related cases. On the other hand, Senator Francis Tolentino disclosed that some hospitals were able to collect benefit claims for COVID-19 cases even if the patients were admitted for other ailments. The COVID-19 crisis is affecting not just people's health but public finance as well in a very injurious way. As the crisis deepens, it begins to unravel that the use of the ADRN fund is just one of the many alleged corrupt practices happening in these pandemic times. Rent-seeking operations are seen to be at play in other emergency response programs as well. there are a number of suspected irregular actions to benefit from COVID-19 response funds. These include the cash allocation to poor citizens. It's similar to the one presented by B. The Philippine government provided 8,000 pesos. So it's probably equivalent to 5,000 baht for 2 months. So instead of the 3 months in Thailand, it's 2 months for the Philippines. But the problem was in the distribution of the funds, there were some irregularities because it was during the first tranche of the program, the release of the funds were through the barangay or village officials of the local government. So sometimes the funds were not distributed to the political rivals of the ones sitting in the local government. So right now there are investigations happening regarding this corruption accusations. So I already mentioned that corruption perception has been on the rise, and this was even before the pandemic. So the pandemic, as indicated also in studies in many countries, have been on the rise, especially in the country. So a task force has been established by the Philippine government. There is a tendency for the government to establish these types of ad hoc task forces. So strengthening public oversight is very important. And I would also mention that during the pandemic, the government took the opportunity to, in partnership with the executive, with the legislature, making the decision to not to renew the franchise of a major mass media organization that is ABS-CBN Corporation, and it therefore limited the information channels available for the people, especially in a time of pandemic. Of course, ABS-CBN Corporation is known for having critical reporting, independent reporting from that of the government. My final segment of this presentation is the need to revive democratic institutions. The rise of populist rule in many countries, including the Philippines, led to the weakening of democratic institutions. Mass media practitioners have turned to self-regulation. Civil society organizations have become less active in confronting public malfeasance. Given the government's lack of tolerance for contrary opinions, the quality of political debate and discussions went down immensely. So even in the way to address the pandemic, the government doesn't want contrary opinions. But certainly the legislature, especially independent elements of the legislature, have played a major role in investigating some of these irregularities. And it's important that public oversight agencies, especially the Commission on Audit, the Civil Service Commission, and the Office of the Ombudsman should be strengthened with enhanced financial and human resources, because these independent oversight agencies do not have sufficient budget. The partnerships made with civil society organizations should be continued and sustained to advance corruption prevention efforts. This would ensure that public accountability measures are supplemented by social accountability mechanisms that keep government officials open, honest, and accountable. Populism triggered authoritarian tendencies that have diminished the role of democratic institutions and systems of checks and balances that control corruption. The outbreak of corruption scandals that accompanied the COVID-19 health crisis in 2020 exemplify how democratic recession has negatively affected the state of public accountability in the Philippines. The revival of democratic institutions is crucial in fighting corruption as well as in fighting the pandemic. So I would like to end my presentation. This point, this is still a draft paper, and I hope to incorporate more cases. So in this presentation, I just focus on a specific case regarding the use of emergency funds under the Philippine Health Insurance Corporation, as well as the social amelioration program. I mentioned it's similar to the one in Thailand, where the government provided emergency cash to the poorest segment of the population, and that is around 18 million of the population, which is a huge part. But I simply focus on the corruption vulnerabilities, and I related this to the democratic recession. So thank you very much.
Okay, thank you very much for your very insightful analysis of the situation in Philippines in response to COVID-19 pandemic here. So usually we think that the response to the COVID-19 pandemic has the two dimensions here. One is the health-related challenge. Another one is the economy-related one. But after hearing from the Philippines case here, I think there is an additional dimension, which is the how to deal with the democratic backsliding or recession issue here. So the Philippines case is very, very relevant, especially for some those who are concerned about the democratic the recession or restore the democratic order in the country here. So thank you very much. Okay, so now we have our third presentation here. Dr. Polier, you can present your paper here. You have 10 minutes. Okay, thank you.
Yeah, thank you. Thank you everyone. Thank you for organizing such a wonderful event, especially in this crisis time. So let me begin. So thank you. So I'm presenting Nepal case. So Nepal's health ministry shared the latest update on coronavirus. So as of yesterday, the country has witnessed 269,450 cases of the coronavirus infection, and then 264,137 people have recovered from the disease. And meanwhile, 2001 COVID-19 death toll confirmed in the country. So COVID-19 in Nepal, when two neighbor giants, China and India, are developing vaccine, and they are also started the vaccination process. Nepal is catching internal political feud, impunity, and poor governance. So the first confirmed cases was on 23rd January. A 13-year-old student returned home from Wuhan on 9 January 2020. So that was our first case from the January. And first lockdown government enforced began on 22 July 2020. After that, series of partial shutdown and restrictions followed. Meanwhile, government formulated COVID-19 Crisis Management Center. That's the government initiation led by Deputy Prime Minister. Right now, all government, non-governmental, including schools, hotels, and cinema halls are also open. It's a like big challenge for all of us. Also, two pictures here. These are the picture from the Nepali migrant workers stuck on Indian border, deny entry to Nepal. That's how human rights works. So some of the migrant worker, they cross the Mahakali River and they try to enter in the country. So that kind of situation happened back in March, April, and May. And the same thing happened to foreign migrant workers, those who want to come in Nepal, but government forcefully they didn't give entrance to Nepal. That was the situation back in March, April, May. So Now the COVID-19 vaccination process has begun. The COVID-19 vaccine drive in Nepal is set to begin from 27 January, following the arrival of vaccine from India. Recently, we have a vaccine from India. Ministry of Health and Population informed that 430,000 people will receive the vaccine during the first phase of the COVID-19 vaccine drive in Nepal, which will last for about 10 days. Within the 10 days, they have planned to vaccinate. India has donated 1 million doses of the Covishield vaccine, which is the local name of the Oxford AstraZeneca vaccine developed in the UK. That is a donation vaccine, but Nepal government doesn't have any plan to. This is a donation vaccine. It has been learned that during the first phase of the campaign, those who are at the high risk of the infection will be injected the vaccine, especially frontline worker, including health worker and staffer, security personnel, ambulance driver, those working in the waste management sector are in the first priority. But government doesn't have any plan to buy more vaccine. That's one of the ridiculous things. So chaotic condition despite of pandemic, that's the democracy. We talk about the recession in Philippines and other countries as well. So recently, Prime Minister dissolved the federal parliament, House of Representatives on 20 December 2020. So without any reason, Prime Minister dissolved the parliament because they have internal political dispute within his political party, and then he dissolved the parliament. That's one of the and every day there's a lot of protest going on, and the Supreme Court is still in the process of hearing the rights feel against the dissolution of the parliament. So that's the Supreme Court is hearing process is going on. We're waiting the result of the Supreme Court. Hopefully, I'm not sure about that, what will be the decision, but there is a 10,000 people out in the street despite the pandemic, which is really, really hard to manage the pandemic right now. And mass protest and rally organized every day by different political parties, civil society. So, but Prime Minister instructed Election Commission to prepare a midterm election. This government is formulated back in 3 years. They have a term another 2 years, but they dissolved the parliament. And Election Commission has geared up preparation for the midterm election. It's scheduled for April 30 and May 10. Most of the people say that's not going to happen because of the current situation, and most of the political parties against the parliament dissolve, so they are not planning to attend the upcoming election. So that's one of the really difficult situation in Nepal. So same time, government bring the shrinking civic space through different restrictive legal measures. So government amendment the bill of Nepal National Human Rights Commission bill, same time Media Council bill and bill on mass communication and information technology bills, and governments under undue interested in the work of NGO and INGO, strengthen rule of social welfare council. That kind of bills they are bringing, and then they are shrinking the civic space. And then civil society also protests against this. And that's why all the bills are now hold. But anytime government can bring this legal measures and bills, we don't know when they're again bringing. Now they are holding these bills. So that kind of situation right now we have. Intensive of negative impact on various groups, especially marginalized groups. Delhi-wise workers from informal sector suffer the most because of the pandemic. So Delhi wages, most of the 82% Delhi wages workers suffer from the COVID-19. 13% low-income group, poor especially, and farmers are suffer more. So that kind of situation. Economic loss of jobs, 60% loss in informal and seasonal jobs, because we didn't have a lot of job creation in here. Either paid cuts or unpaid for permanent employees also happening. Reduced import-export things. Partial shutdown of manufacturing sector, especially education and other sector, complete shutdown of tourism and entertainment industry. As like Thailand, Nepal is also a tourism-based economy, but we call this as a agriculture-based economy. But there's a lot of tourism industry here, but that's not in operation, which affect informal sector groups. So that kind of situation here. So corruption during pandemic also rises. Nepal is the 113 list corrupt nation out of 180 countries, according to the 2019 Corruption Perception Index, reported by Transparency International. And Transparency International recently released one report about the corruption, where our Prime Minister and bureaucrats, and especially high-level government official, also even though they are not involved, but they have intention to do that. That's kind of report recently Transparency International released. And that there was a lot of controversy about that also, but there is a lot of corruption. And then people believe government corruption has increased significantly in Nepal in the past 1 year. A study based on Transparency International Nepal. An amendment of the Public Procurement Act to involve Nepal Army, which is already outside jurisdiction of the Commission for the investigation of use of authority when they are buying the medical equipment from China. So they involve the Nepal Army because of this, and there is a lot of issues. Ministry of Health and Population, when they are buying the medical equipments, there is issues of the corruption when they are buying even medical equipment during this pandemic, which is really surprising for people. So when they are buying medical equipment, and there is a lot of corruption issues arise. So I already mentioned the two pictures there: poor handling of returning migrant worker during the pandemic. So especially those working in the India, and they wanted to come in Nepal, and then they had to stay in the Indian border and marching and then chanting to come Nepal, which is really shameful for all of us, those who are working as a civil society actor. So increased threat of pandemic, no concrete plan to cope the pandemic, and lack of preparedness. So that's a lose of the faith among the general people toward the elected members and especially government officials, because that's the result of the pandemic. So we don't have that's research, poor research laboratories and demotivated medical person, because there is no facility for the even PPE, even the basic things. Or when this pandemic happened, there was not basic things for medical personnel. There's a breadth of the testing labs and medical facilities, substandard medical support system. Medical personnel are on strike in various hospitals, demanding risk incentive withheld from last 8 months. Hospitals beds are filled with COVID-19 patients. New cases are forced to remain at home isolation. Shortage of testing kits and ventilators also. So still that's going on. So recommendation based on some of the research, and local governments need to conduct a rapid need assessment, make door-to-door visit, and keep accurate records of infected people. The number and location of the most marginalized and vulnerable groups should be identified and officially recorded by each ward office in all provinces. Special support such as medical facilities, should be made available for the needy people in case of emergency like lockdown or shutdown situation where people doesn't have money to buy the food. So government need to enlist credible CSOs and work jointly for relief activities, especially government doesn't have sufficient people to deliver that kind of things. Should be able to assure transparency and prejudice-free relief activities. The federal government should develop a broader central policy guideline on pandemic control. Provinces and local governments need to formulate their guidelines on pandemic control based on their contextual realities, which is not happening right now. The relief standards set by federal, province, and local governments need to correlate, thereby avoiding confusion and dispute over emergency management practices, making collaboration among the CSOs, government agencies, which is easier, which is not happening. So keep the vulnerable citizen prepared. Information, education, and communication, which is important. Policies, tools, techniques need to be developed and disseminated exclusively for the climate ties like COVID-19, earthquakes, floods, or more. So annual budgets should be planned for future emergency awareness and resilience building programs. The support and relief materials should commensurate with the extent of marginalized and vulnerable of the individuals. The law should be strictly implemented against the violation of the high human rights of marginalized and vulnerable communities and all. More penalties should be imposed on those who practice discrimination and exclusion during this crisis and pandemic. So way forward, the mass gathering, especially mass gathering happening right now, and then transmission is growing day by day. Should be prohibited as far as possible, but the people are coming because of the parliament dissolved, so it's common. Otherwise, the protesters should follow the safety protocol strictly during the protest. Motivational move compensation for people from low-income groups. We don't have any government plan like the Philippines. Government is not giving any penny to marginalized and workers. First, they distributed all better materials, but there is no any special plan. Workers from informal sector, especially non-exempt employees and people from marginalized communities, incentive for medical personnel and security forces, those who are in the front line. So have a board central policy guideline on pandemic control, and for the disaster also, we need to think a little bit longer term also, which is not happening. So expedite the monitoring system and ensure the proper implementation of the COVID-19 related policy, which is not happening. Actually, we don't have a really good policy, and whatever we have, but that's not implementing. So transparency in the procurement and expenses should be of top priority. So most of the corruption in this procurement process is happening. So maintain a balanced relationship with the both giants, India and China, and get benefits in terms of obtaining medical supports against the pandemic, for economic growth, and for the political stability, which is not happening now in the crisis of parliament dissolved, and we have a new crisis is beginning in this country. So let me stop here. If you have questions, maybe I can answer some of the things later also. Thank you very much.
Okay, thank you very much, Dr. Perea here. So it is the wonderful presentation for the detailed information about the situation of Nepal here, I didn't know that the Nepal already got the vaccine from India here, so that's very interesting information about the next phase of the vaccination against the COVID-19 pandemic here. So now we have about 30 minutes for question and discussion here. So let's just start with our pre-arranged questions, and this is also some of my questions as well here. So the three presenters now give us some general commonality of the challenges as well as the country-specific challenges here, but for the comparative perspective, I think there are say some triangular challenges of the COVID-19 pandemic here. One is obviously the dimension of health policy, so how to effectively contain the coronavirus here. But at the same time, each country are struggling to minimize the consequence of the health policy upon the economy. So the dimension of economic policy is also very important, but at the same time, one of the most important dimensions of the challenge is about how to maintain democratic, for example, rule of law or check and balances, or how to reduce the corruptions or how to increase the transparency or accountability here. So health policy and economic policy, as well as some dimensions of democracy. So this, given this some sort of the trilemma situation of the COVID-19 pandemic challenge, I want to hear which dimension is to prioritized in your country in dealing with COVID-19 pandemic. So that's our the first question, for the common question for all of you. So let's get the response from the first Dr. Bureekul, and then Dr. Margano, and then Dr. Paria. Okay, so let's start with the response from Dr. Bureekul.
Okay. In response to the question that you mentioned, now we have a very good network of civil society who participate in monitoring the exercise of state power, and also the opposition party in the parliament that keep an eye on the implementation of the government, and they are going to organize the censor debate for the government. So I think the information about the dissemination of the vaccine and also the money allocation to the poor will be raised also, because some issue about vaccine become politics recently, because the distribution of the vaccine and the money that's spent for buying vaccine. And there's a question from Dr. Lee about the vaccine, whether Thailand got the vaccine from China. Yes, we are going to get the vaccine from Sinovac in February. By February 28, we are going to get 2 million doses. And by March, we are going to get another 800,000. And by April, we are going to get another 1 million doses. And then in May, we are going to get 26 million doses from AstraZeneca that they transfer technology to Siam Biosci, the vaccinate company in Thailand, in order to manufacture the vaccine for Thailand. So we are going to get altogether 63 million doses by the end of this year. So we hope that we are going to distribute the vaccine to the neighboring country also. And another question about how to increase the democratic governance, rule of law, and reduce corruption. I already told that the people, also the social media, is the important mechanism that the people keep an eye on the implementation of the government policy, because they are affected by the COVID-19, and the government borrow a lot of money from the bank in domestic and also the foreign country for this purpose, in order to lower the economic recession. So I think that the Anti-Corruption Commission and the civil society related talking a lot about this, and also for the rule of law. The enforcement of law is very strict now because of the severe case, but for the case related to gambling and also the illegal labor now also being discussed, and the people concentrate mostly about this also, especially by the opposition party and civil society, because the people are really angry with this. And even the tourist industry people, they would like to sue the illegal labor because of this also. Okay.
Okay, thank you very much. Naturally, already you have responded to the question of Dr. Suk-Jung Lee here. So let's move to Dr. Maluno. You can respond to my question as well as the question about the vaccination from the Suk-Jung Lee and the Angelita Cruz as well. Okay.
In the case of the Philippines, the first COVID-19 cases were also came from tourists from Wuhan. With respect to the response, can be said that the Philippines is quite late in terms of imposing travel restrictions. I remember that when the health secretary was giving a press conference, he was saying that we do not want to damage our relations with other countries with respect to tourists, especially from China. So it's kind of a wait and see attitude. But when the risks were seen in March, the Philippines had a declaration, a proclamation of a national emergency. But it went to the extreme of imposing a national lockdown. So it is a hard lockdown, although most of the cases were in Metro Manila, in the National Capital Region. The policy became a national restriction, so a stay-at-home policy. So for a long time, the Philippines imposed very general lockdown. It came up with its own term. They call it the enhanced community quarantine. The problem was that the health interventions were also late, especially in setting up laboratories. So at the start of the pandemic, there were very few laboratories, mostly based in Manila, and there are two other laboratories in the central part of the Philippines and in the southern part of the Philippines. Considering the archipelagic character of the country, so many islands, so that is very insufficient. So while people were locked in their homes, they're staying at homes, the health interventions were very late because the tracing of those who have the virus and the transmission was very insufficient. And we didn't use much of technology, unlike South Korea, using contact tracing applications. It also came late, but right now it is very much in use, contact tracing digital applications. So we can say that there were efforts really to do social and physical distancing. So that was the major intervention at the early part. And this created problems in the economic front. Because there were very strict restrictions, only essential services are allowed to open. So business establishments were mostly closed except for those offering essential services. So as a result of that, assessments made in Asia, it appears that the Philippines is one of the countries that will be also late when it comes to economic recovery because of the effects of the nationwide lockdown. So it's only in the, should we say, September or the latter part of the year that the Philippines decided to have localized lockdown, allowing local governments to decide on lockdown policies. Although the national government, the central government, still issues announcements regarding the state of the quarantine for the specific provinces and cities. So you have that kind of arrangement. With respect to the vaccine, so in fact, there is a controversy in the country because for a long time there has been a move by the Philippine Senate to replace the health secretary. But then since the health secretary is an appointee, we are a presidential system. So the key heads of agencies are appointed by the president. So the president did not listen to the suggestion to remove the secretary. So the health secretary that we had at the start of the pandemic is still the health secretary right now. So controversy emerged when the foreign affairs secretary revealed that the Philippines had an agreement with the United States that 2 million doses of Pfizer will be available to the Philippines at the start of the year. But then the controversy noted that the Foreign Affairs Secretary noted that somebody dropped the ball, and that person is the Health Secretary. And so there is now a continuing Senate inquiry on why the Philippines seems to favor Chinese vaccines. Although when it comes to what we have in the country is some kind of emergency use authorization. The Sinovac, there is already some kind of a negotiation undertaken by the Philippine government to get the large bulk of the vaccines really from China. But then the Sinovac has not applied for an emergency use authorization. So currently, Pfizer is the only vaccine right now that has acquired the emergency use authorization. And so we still have a separate vaccine as vaccines are separate from the Department of Health. So the vaccines are announced that Pfizer will be able to send 2 million doses late in January, probably early February. So the first vaccines will actually come from Pfizer. And we're still waiting for the Chinese vaccines. Although this would be at commercial rates, I think. Not commercial rates, but it's not a grant of the vaccines, but it's going to be paid. And that's another issue that's being discussed in the Philippine Senate because the cost of the Chinese vaccines appears to be higher than the other vaccines. So there is some kind of legislative oversight that is going on right now. So I think the other vaccines would also come from India because the Philippines is also negotiating with the Serum Institute of India. Thank you.
Okay, thank you very much. Okay, now let's move to Dr. Perea. You can share your gear with us.
Thank you. I'll say a few things. How we treat the COVID in initial days. One of our tourism minister shared with the Nepali media that Nepal is a corona-free country, so let's bring more and more tourists. So that was the initial days thinking. So later, government health ministry couldn't perform very well, and then the prime minister sacked three ministers, health ministers, and now we have a new health minister. So it's a kind of a crazy situation because they couldn't deal the things in a proper manner. In terms of vaccine, we got the free vaccine from India for around 400,000 people. After that, we don't have any plan to bring more vaccines. So government doesn't have any plan to bring more vaccine because government doesn't have enough money to buy that vaccines. They are waiting. China will give some vaccines like India and free because government in the new mess because government dissolved the parliament, especially prime minister dissolved the parliament, and then now most of the political parties, they are in the road and they are protesting every day. 10,000 people every day in the street, and then they are marching every day. So It's very difficult to manage the COVID. I don't know how it's managing, but it's kind of crazy situation here. Another things about the vaccines, if we get the more vaccines from our neighbors in the free, we'll get, I think so. From the government side, I don't see any plan from the government side. Recently, I met the health minister also. How can we send this vaccine to most marginalized, vulnerable peoples? And he told us they don't have exact plan for disseminating the vaccine also. Because we don't have a sufficient infrastructure to store the vaccines and disseminate the vaccines also. But they're preparing especially for health workers from the next after 2 days from the Wednesday. Hopefully, hopefully that will succeed. But it's difficult because we have a political crisis right now, so we don't know what it will look like. But I can see, and then maybe we need to pressurize the government to buy the more vaccines rather than new election, because we are spending a lot of money for the new election if it's going to happen. So, but people are not getting a vaccine. So it's a very contradictory situation here. So we need to work on that. Maybe we can build the resilience community, and then we don't know. Economic situation also difficult situation here. So now people are focusing on business and economics. But the thing is, COVID-19 also creating the inequality among the people. Those who have resources, those who have a connection with the authorities and government, they're taking a services in the hospital or vaccines. But those who doesn't have access to government, it's very difficult for them to get the service from the hospital. Maybe they are not getting the vaccines also. I really worried about the current situation about the political mesh right now in Nepal. Thank you.
Okay, thank you very much. Now I get a question from audience from Steve Chan here. So question is, does your country, so this is for the Dr. Margano as well as the Dr. Perea. So does your country have a national decision-making organization led by medical professionals in response to the COVID-19 pandemic, such as the Center for COVID Situation Administration in Thailand? So and if so, then that organization is accountable to the chief executive or the minister, and how about the effectiveness and efficiency of the decision making in that organization? These are questions from Steve Chan. So Dr. Margano.
Thank you for that question. We don't have a similar setup like in Thailand, where you have an association of medical professionals whose inputs are really taken in by the government. What we have is a kind of task force. We have the Interagency Task Force on Infectious Diseases. It's a intergovernmental agency led by the secretary or the Minister of Health. And they invite resource persons during their meetings. So that includes the College of Physicians and other medical professionals. So we don't have that kind of setup where you have a dedicated center for infectious diseases. But what we have is we have medical professionals and their associations. They are invited to provide some kind of inputs to policies and decision making. But it's not a regular setup where they report really to the president or the chief executive.
Okay, thank you. So Dr. Perea.
We have a COVID-19 Crisis Management Center called CCMC, led by Deputy Prime Minister. But the thing is, there are not medical professionals, especially experts. They are invited sometime, but the government doesn't listen properly to them. That's the things. This CCMC COVID Crisis Management Center led by Deputy Prime Minister and other secretary. But the thing is, they are not listening the expert most of the time. So they're only looking the this what called this reading process, buying the things. It's a really their interest is buying the things, buying a material contract, that kind of things they are dealing. They are not really listening the health professional. They are not listening the civil society. They are not listening the expert. That's the situation. But they have a COVID that's called CCMC. They're led by the Deputy Prime Minister. There is an institution, but they're not listening the health professional. And one thing I just wanna mention that we also started one civil society campaign from the civil society also to make the government accountable. The leading by former prime ministers and renowned social activists there, and then every month we did a press release, and then having the making the demand to government, and I'm also part of that. So we have a civil society active civil society to make the demand, but government doesn't listen us also. Reality is that.
Okay, thank you very much. We are supposed to stop our discussion because this is already past the 1:20, which is the due time here. So I just want to give just 1 minute's opportunity for each of you have some last comments about the others or the audiences about the situation of your country. Dealing with the COVID-19 pandemic here. So, Dr. Bureekul, do you have any last comments here?
I would like to thank the audience for the participation. And actually, Thailand is very effective in handle this so far. But now we are working very hard to cope with the situation that widespread few months ago. And luckily that we have the CCSA that established according to the order of the Prime Minister. So it's very big organization that control a lot of center in various sector. So many experts participate working in this center. Ranging from the private sector and also the professional and also academic and the politician also. So we hope that in the near future, Thailand can cope with the situation and we can work in collaboration with the neighboring country related to the vaccine manufacturing, because now we have the vaccine company that are able to get the technology from AstraZeneca to manufacture in Thailand and then help the other country also. Thank you very much.
Okay, Dr. Maguno.
Okay, when the pandemic started in the Philippines, there were so many challenges, and the problem was that at the start, the government doesn't want to listen to other opinions, but later on, the response is getting better with all the efforts and the support of medical professionals. So there's also been the important role of legislative oversight, especially the Senate. So it's very important, therefore, that there is oversight by institutions to make the process accountable. So the key challenge is accountability and performance. So it's not just corruption, but actually delivering the performance. And the Philippine example showed that local government units should also be a big player in this process, as well as the important co-production role of collaboration and civil society organizations. So we hope that the process will improve through democratic and accountability procedures. Thank you.
Okay, thank you very much. Dr. Paria?
Thank you. I already mentioned about the now we're in the political mess and a political crisis because of the parliament dissolved by Prime Minister. So I already mentioned we don't have any plan to buy more vaccines. So I request friends, neighbors to support the Nepal. So in a way, whatever way you can support, that's necessary for especially most marginalized and vulnerable people, because government is not looking in that manner. So I request for that. Thank you for organizing wonderful event. Thank you.
Okay, great. So thank you very much for all of the speakers, as well as the audience who have given us the insightful questions here. I have learned a lot, and then among them, two things are very clear. In a time of COVID-19 pandemic crisis, the spread of coronavirus must be contained, but at the same time, the spread of good idea and best practice must be facilitated through this sort of the online seminars. So I hope we're gonna have another round of this ADRN online seminar in the near future. And then once again, let's see. It is not possible. We can see in person, but we must have some idea exchange even in online and in this Zoom-based conference. Okay, thank you very much. This is very, very productive and very insightful conversation among the wonderful presenters as well as the audiences here. Thank you very much.